So, okay. So it just says, tell me about yourself. So just like.
Okay, so I started my career in oncology. I have worked for since 1987, and when in 2005 I decided to go back for my nurse practitioner, so I went to the University of Pittsburgh. It has an acute care nurse practitioner program. The reason I chose Pitt was because that's where oncology fell, was under acute care, and they had an oncology specialty tract. So I finished that program, came back to work after 21 years in outpatient oncology because my degree was acute care.
Sorry, I'm just going to let you know they did not okay this for Tamara.
Okay.
But I'm going to talk to Julie. And
It's okay. We'll just call Tamara and see if there's another day she can come. You know, I mean, if they can't do it, they can't do it.
Yeah.
So just see if there's another day that works for her. Thanks, Diane. So because it was an acute care training, when I finished, there was no opening in oncology when I came back. So I ended up working in pulmonary critical care for 2 years.
Oh, that's a big difference.
After 21 years as an outpatient, oncology, yes. So I did that, and then when a position came open back in oncology, I came, and so yeah, that's kind of, I am an advanced oncology certified nurse practitioner as well. So yeah, it's all been good.
Describe your APRN position, including the specialty.
So I have my own clinic. I have a lot of what I do is see benign breast issues as well as breast cancer follow-ups. And I'm also starting a high-risk clinic for patients who have a strong family history of breast cancer. We're just in the process of getting all of the PR stuff done, the flyers and the newsletters and all of that. So I've been doing high risk within my clinical practice, but we want a dedicated high risk clinic. So hopefully,
with the amount of family history and stuff.
Yes.
That's absolutely neat.
So and I mean, they want to officially start this as a dedicated program this month.
So you have a lot going on.
So
there's always more going on. Do you see an APRN influence in today's healthcare system? If so, how? If not, why?
Absolutely. I think that our roles are critically important. The part that frustrates me is that so many practices do not allow their APRNs to practice as they've been trained, and that's a huge frustration. And I also am a little concerned at where we're going as as clinicians, as professionals with the APRN role, and making sure that we have properly trained and properly precepted the new and nurse practitioner grads. Those are my concerns.
Being thrown out unprepared.
Correct.
Yeah.
Yeah, and I've seen that here in oncology specifically, but yeah, I want to. So enough said on that.
What are some of the barriers that APRNs face?
Probably the biggest one is pushback from physicians. I believe that. I had a patient that I saw. I don't know if you want me to do that. I mean, I don't. Do you have enough time on here?
You can. I have to. Yeah.
But I just have to tell you this story. I had a patient that I saw who was a new consult for me. History of breast cancer. I saw her. I worked her up. I had concerns on exams, so I sent her for scans. She had a lung nodule. There's nobody knows what to do with it until you have biopsy. So I ordered a CT guided biopsy of this nodule. We needed it. She had a personal history of breast cancer. I needed to know, is it lung primary or is it Mets? So it was my patient, and the interventional radiologist called me and said, I can't take this order from you. I said, okay, why not? And he said, I need Dr. Gant to call me. I said, Dr. So-and-so. I said, she's never seen the patient. This is my patient.
Mm-hmm.
Well, there's a lot more to this than you understand. So
Oh
that's
my
my
gosh.
frustration. Some physicians are very, very good, but always having to prove your knowledge is
Yeah.
really frustrating.
They don't trust that, like you said,
Yeah.
people haven't been prepared
Yeah.
enough.
So
Yeah. What changes would you like to see made for APRNs?
the ability to practice independently. That is my huge driving force, and I hope that I see that with more and more providers. I would like to see the emphasis return to quality instead of numbers,
Mm-hmm.
and I think that would help further the APRN community cause, where they could see we can make a huge impact on quality.
Mm-hmm.
And understanding our role. I know when I need a physician evaluation or support, but here in this practice, I can seek that on a collegial on a level,
Mm-hmm.
is what I would say. It's not that they're my boss or superiors. It is truly collegial, and I hope that for every advanced practice nurse.
Like working together. Yeah.
Yeah.
Absolutely. Well, that's all my questions. That's it.
It was easy.
Yeah.